Thanks for joining me today. The purpose of today is basically we're just going to run through patello femoral pain. So that's runner's knee that I've been posting about all week. So it's kind of going on the theme of running injuries, which we've been talking about for the past couple of weeks. And runner's knee is the most common thing that comes to me in my clinic. So I wanted to do a short series on it. So what is runner's knee? Well, basically it's patello femoral pain. What is the patello femoral joint? That is where your kneecap sits on the front of your knee. So your kneecap, which is your patella, sits in a groove on top of your femur, which is your thigh bone. And as you bend and straighten your knee, the patella tracks up and down. Now, if you have muscle imbalances around your patella, your kneecap, then what can happen is that can lead to the kneecap being tracked one way or the other rather than up and down. And you can get a little bit of irritation of the structures around the kneecap. And that basically leads to pain, and that is what runner's knee is. So that is patello femoral pain. So if a patient comes to me with knee pain, the common kind of signs and symptoms of runner's knee is that it's a bit of a vague, diffuse pain often that's commonly kind of around the front of the knee. It's around the kneecap, it can be on the inside, it can be on the outside. Very, very rarely I've seen it on the back, but it can be. It can sometimes get a bit swollen due to this irritation, and it's commonly worse when the patient bends their knee. It's also commonly worse when someone walks downhill or when they're going down a step. However, it can also be painful to go up a step. So that's what it looks like in clinic. Now, basically the best management for runner's knee, and the evidence support this, and what I've seen in clinical practice supports this as well, is that exercises is the best treatment for runner's knee. And let me just kind of put a disclaimer out there that I'm kind of giving you an ideal picture here. Not everyone obviously follows that ideal picture, and some people might be a bit different. But commonly what we see is that someone who gets runner's knee, it might be because they've got weakness in their gluteals, so their bottom muscles, and their quads muscles, their big thigh muscles. Now what can happen, especially with these quads muscles, is you can get a little bit of pain inhibition. So due to the pain, the muscle stops working. And especially what goes a bit sleepy is this VMO, this vastus medialis oblique muscle here on the inside of the knee. It's your most medial quads muscle. And this VMO goes a bit sleepy, and sometimes the lateral structures, the lateral quads, get a bit overactive. So the first thing I'll do is I'll teach a patient where this VMO muscle is and how to activate it. So a good way of doing that is sitting on, if you have a gym ball. If you don't have a gym ball, you can sit on an office chair. You're going to put your hand on the inside of your knee, and you're just going to bend over that knee and then bend over the other one. Now what I'm doing as I'm bending over that knee is I'm feeling the VMO, that little muscle there on the inside of the knee, I'm feeling it tighten, okay? And that is telling me that my VMO is activating quite nicely. And I get patients to compare both sides, and sometimes on their symptomatic side you'll feel that it's a little bit more sleepier on that side. So that's how we switch on VMO, the medial quads, and then I'll get them to do some knee extension. So like I showed in the video, what we're going to do here is we're going to tie a band, and we're going to bend our knee and then extend it against our TheraBand. Now what I'm doing again is I'm getting them to touch the inside of their knee, their VMO, and make sure that they're working that medial quads. Because what I don't want to happen is I don't want them to be just kind of ploughing away like this, just working their lateral quads, which we know is really nice and strong. So actually, these exercises are what's called motor control exercises. So we're trying to teach the brain, firstly, where that muscle is, and secondly, how to activate it. So I'll be saying, right, put your hand on that muscle, and use that muscle to straighten your knee. Okay, so use that muscle to straighten your knee and feel it tighten under your hands. Now with these motor control exercises, we can do quite high repetitions. So I'd be telling someone to do maybe 20 or 30 repetitions at a time. Except, if that muscle gets fatigued, you want to stop. Because the first thing that will happen as that muscle gets fatigued is that other stronger muscles will take over. Okay, so make sure you don't do motor control exercises in a tired condition. So we've switched on our quads. Now how are we going to switch on our glute muscles, our bottom muscles? So one way you can kind of just give a patient awareness of these glute muscles is just to get them squeezing their bum together. So basically imagine like you've got a cork between your bottom cheeks and you're squeezing it together, and put your hands on your bum and you feel it tighten. However, that's more likely to contract your glute max muscle. And a lot of the kind of research that's been done on runner's knee shows us that actually you get weakness in your glute med muscle, which is an important stability muscle around your gluteals. So I'm going to show you my favourite way of getting this muscle to switch on. And that is in a side-lying hip abduction exercise. So you're going to lie on your side, and you're going to bring your bottom knee up to 90 degrees, okay? You're going to fully lie on your side. And then this top leg, you're going to tighten your glutes and you're going to lift your leg up. Now what people commonly do wrong is they roll their hip back before they lift. And what I'm doing here is I'm going to just be working my hip flexors and my quads. So you must make sure you keep that hip forward. And again, you can get a patient to hold with their hand to keep the hip forward. So I'm tightening my glutes and I'm lifting up. Make sure they keep their leg in line with their body. Don't let the leg come forward, because again, if the leg comes forward, I might be working more of this lateral quads rather than my glutes. So leg in line with my body, it feels a bit behind my body, tighten the glutes and lift. So this is how we're going to switch on glute med and start to get it to work in a nice position. Okay, so we've switched on quads, we've switched on glutes. So we've done some motor control, some activation exercises. Now we want to start to think about our dynamic control. So the exercises that I put on Instagram was a single leg step up and a rear elevated split squat. So just to kind of reinforce, there are so many different versions of these exercises that you can do. And I'm just kind of picking some of my favorites that I tend to prescribe. But essentially with our dynamic control exercises, what we're thinking about is when someone is running and when they are landing, oh, sorry, that shouldn't have happened, sorry, I did put do not disturb on and it didn't work. When someone is landing, are they maintaining good alignment with their hip, knee and their ankle, okay? Because if they're not, and they're rolling in and getting what's called this medial collapse of their knee, they're going to put the structures of the medial knee and the lateral knee under tension and lead to pain, okay? So we're going to work that in our dynamic control exercises. So the exercises I put on Instagram earlier this week were the step up, okay? And I did that with a TheraBand, because if you put your foot in a TheraBand and the TheraBand's pulling my leg that way, my glutes have to work to pull my knee that way. So as I step up, I'm switching on my glutes, because if I don't, the TheraBand's going to pull my knee in. So I switch on my glutes and I step up, and then I control it back down. So with all of these single leg exercises, you must make sure hip, knee and ankle stay in a straight line, because we're retraining our dynamic control, which is required for running. The other one that I put on Instagram was a rear elevated split squat. So you put one leg up on a surface, something a bit higher like a chair if you have, and that's going to help you control a nice single leg squat through that right leg. And again, thinking about the control, so hip, knee and ankle staying in a straight line. So that is our dynamic control exercises. And then once you kind of really nailed that and you've mastered that, you can go on to look at your strengthening movements. And these are things that most people are more familiar with. So this is your squats, your split squats, your deadlift. Just to show you a little trick again, which I put on Instagram, is you can do your squats with a band around your legs. Because what this does, again, is if I push out against the band, I'm going to be activating into those glutes before I squat. Because when you squat, it can be quite a quads dominant movement if you don't think about those glutes. So this can really help to switch on those glutes first, if that is a muscle that you are deficient in. Okay, so we've talked about strength, One of my favourite strength exercises, by the way, is a split squat, because there's so many variations you can do here. Just by going up and down, you can add weights here. You can add weights here. You can hold something above your head. This makes it quite difficult for your core to work. You can do walking lunges to make it a bit more dynamic. You can do backward lunges. So many different variations, so I do love that exercise. So we focus there just on a few kind of my favourite exercises. The other thing that if you do have runner's knee, patello femoral pain, you need to think about your load management, okay? Because sometimes it's because you've been running or training too much, and it might be that you actually need to take a few days or sometimes even a few weeks off running, or at least reduce your load. And what I say, and I encourage patients, is I say, look, take the time off, but work on your control, work on your strength, and then you'll come back a lot stronger. And then when you can start to do your running, you're able to progress it, and you'll be a better and faster runner for it. So if you do take some time off running, when you return, make sure you return easy. So you don't return to kind of the volume or the intensity that you were doing pre-injury, but you return at kind of like a 50% volume. So 50% of what you were doing, and probably you'd even start with 50% intensity. So you'd keep it nice and flat, nice and slow, and then you would gradually progress. And we talk about 10% progressions each time. Because if you progress the load too quickly, again, you're just likely to kind of get symptoms again. So you've got to be really careful with this load management. So I hope that has been helpful. Any questions, please feel free to, DM me. You can ask them now if you want to put it into the text. But any questions on runner's knee, I'm more than happy to answer. And I do hope that you find this content helpful, because runner's knee is something that really strengthening exercises can massively, massively help with. So yeah, let me know if you've got any questions. Otherwise, thanks very much for listening, and I will see you again next time. Bye bye.